targeted therapies are meant to pick up one of the pathways in the cancer cell. What does that mean? Cancer cells survive and thrive through a variety of signals, and these signals are mediated by a lot of proteins in the body, a lot of receptors which are the signal catching points on the surface of the outer coat of this cancer cell. And when you block this signal catching point, this becomes a targeted therapy. So therefore, any treatment which is meant to stop these signals flowing into the cancer cell and making it work faster, divide faster, spread in the body system is called a targeted therapy. There are a variety of targeted therapies, and these may be given by mouth as pills or capsules. They may be given as injectables or injected under the skin or dissolved in a little bottle of glucose and injected through a vein into the body system. Therefore, there is an opportunity to use these targeted therapies in the hospital, in an outpatient clinic, or even at home. Let me assure you that the number of targets which have been identified in the last 20 years has given us a plethora of drugs, and most of these drugs are actually taken by mouth. They are taken at home and only periodic visits at about 4 to 6 weeks to check some blood parameters and to do some physical check may be required, or a scan in about 3 to 4 months may be periodically required. But most of the therapies are being administered sitting at home. Chemo means chemical. These drugs were discovered in the 40s and 50s, and then the next generation of chemicals were discovered subsequently to develop into potent anti-cancer drugs. These drugs are meant to kill a living thing in the body system, and these drugs identify the cancer cell based on certain unique biochemical and biological properties of cancer cells. Now, these drugs cannot identify purely cancer cells. Therefore, these drugs will cause destruction of the cancer cells and also cause collateral damage on some of the normal cells, which are also fast dividing cells like the white blood cells, platelets, root of the hair follicle. That's the reason one gets loss of hair, one gets a low immunity, low white cells. So these drugs essentially are non-specific cell kill drugs. Now imagine when we move away from these chemicals and use drugs which are going to pick up only one signal catching point. It's like depriving the cancer cell of a vital signal to grow, to thrive. The cancer cell automatically dies off. Therefore, the collateral damage is not going to be that much. And that is the reason why these drugs are more precise, they are more potent, and they are more patient friendly. Targeted therapies do not cause a lot of collateral damage. Therefore, the quality of life is preserved. Patients are able to work, they are able to lead a normal family life and be as productive as anybody else in the society. So the side effect profile is much more patient friendly with the targeted therapies.